How many days can you stay in Mexico before you lose your health coverage? This guide from Canadians and IMSS covers the Snowbird absence day rules for 5 provincial health plans: OHIP, MSP, AHCIP, RAMQ, and Manitoba Health. Your travel insurance depends on it. First, your provincial health card is the foundation, not just for care at home, but because most private travel insurers require it. Second, insurers require it to stay active for your full trip. If it lapses mid-stay, the whole policy can be affected. And third, if it lapses while you're in Mexico, coverage can void, meaning a hospital bill in Puerto Vallarta or Merida lands entirely on you. Here's the quick version. Ontario's OHIP allows 212 days per 12 months with no action required. British Columbia's MSP allows 212 days per calendar year, but you need to contact Health Insurance BC in advance. Alberta's AHCIP allows 212 days per 12 months and requires contacting Alberta Healthcare Insurance Plan in advance. Quebec's RAMQ allows 182 days per calendar year with no action required. And Manitoba Health allows 212 days per 12 months, with an online form required before departure. Ontario's OHIP allows up to 212 days. It's automatic, no notification needed, but you must spend 153 days in Ontario. For a permanent move, coverage ends the day you leave, with no grace period. British Columbia's MSP has a standard limit of 183 days. A 212-day extension exists, but only if you call Health Insurance BC before departure. Skip the call and you're capped at 183. For a permanent move, MSP coverage ends the last day of your departure month. Alberta has a standard limit of 183 days. A 212-day extension is available if you contact AHCIP before you leave. The same opt-in structure as BC. For a permanent move, AHCIP coverage expires the day you leave with no grace period. Manitoba Health allows up to 212 days, but requires the online temporary out-of-province form before departure. It also has the most generous permanent move grace period of the 5 provinces shown. Coverage runs through your departure month plus 2 extra months. Quebec's RAMQ caps snowbirds at 182 days a year, the lowest limit of the 5 major provinces, but 2 exceptions can work in your favor. First, short trips don't count. Absences of 21 consecutive days or less, plus your departure and return days, are excluded from RAMQ's total. Second, the 7-year provision. Once every 7 years, RAMQ allows a longer absence for personal reasons if you notify them in advance. Third, split stays across years. A long trip spanning October through April is counted separately in each calendar year. A common way Quebec snowbirds legally stay away longer. Snowbird versus permanent mover. A snowbird keeps Canadian residency. They stay under their province's absence day limit, and their provincial health card and travel insurance both remain active the whole time, as long as required paperwork is filed. A permanent mover gives up provincial coverage. It ends on a fixed date, immediately, end of month, or a short grace period, depending on the province. From that point on, they need Mexican or international private coverage. Don't guess your way through this. The provincial healthcare transition timeline calculates your remaining allowance and reminds you before deadlines, so your coverage never lapses. We also offer personalized private insurance plans chosen for your health profile, travel pattern, and budget. And if you'd rather go the public route, we walk you through exactly how to apply for IMSS step by step.